Good afternoon, everyone. It's an absolute pleasure to be here. So thank you very much for the invitation to share our work with you today. Thank you. So this is where I'm based. I'm based in Brighton in a research centre. We like an acronym at Coventry, so it's called CORE, and it's the Centre for Agroecology, Water and Resilience. I've only recently moved to CORE, so please don't ask me any really difficult questions. But it's an amazing centre, and we have some colleagues doing some absolutely fantastic work nationally and internationally, and they're looking at a whole host of areas: water and society, food consumption and waste, animal geographies, and cross-species resilience. And my work is located not in any of those, but my work is located in a theme led by Professor Moya Nisfi, which examines the ways in which communities self-organise for resilience. The uniqueness of our centre, one of the really amazing things, is that it brings together academics working in the natural and social sciences. So we have an inbuilt multidisciplinary team. So the title of my presentation today is Researching the Evidence, but researching the evidence around land-based interventions with marginalised and vulnerable communities. And I use the term land-based interventions in this context to include programmes and projects that involved using the land in any capacity. So it's activities such as gardening, food growing, but also activities like construction, beekeeping, working with livestock. So anything that we can link to the land. And today I'm also using land-based interventions in terms of our work, in terms of projects that are delivered by the public, voluntary and community sector, and projects that are delivered in the community but also in secure settings. So today I want to share briefly our approach to this work, some key themes stemming from the work we're doing, which I may not dwell on for much of the presentation, because some of these themes we can see already today are reoccurring around the health benefits and the well-being benefits and all of these positive outcomes that are increasingly being evidenced by research. But I also want to think about why we believe this work is important. The presentation today will draw on 3 projects. These are 3 projects that I've led and obviously been involved in. The first project, one of the projects, is Unlocking Nature. It was delivered by the Conservation Foundation. That's where I met David and Lindsay, so thank you. It's an interesting project and raised a number of challenges. And this project was delivered at HMP Wandsworth, and it aimed to transform the outdoor space and introduce a range of land-based activities. The second project is the London Food Poverty Project. It's a project that we've recently completed, and this project was led by Garden Organic, and the aim of the project was to work with communities to address food insecurity and security. And the Master Gardener Programme at HMP Rye Hill, which was my first introduction into thinking about the use of land-based interventions with marginalised and excluded. All these terms, they are vulnerable, excluded, but working with marginalised communities. And this one was specifically targeted at working with prisoners with a substance misuse issue. So, this is my starting point. So I've worked as a researcher for a number of years, and I feel it's really important for us as researchers to sort of set our stall out, our position, our relationships to the work we do. Because I would argue that implicitly or explicitly, as researchers, our values are present and shape the choices we make at every stage of the research process. So this slide tells you a little bit about me, some of it relevant, some of it you may think not. I think Aston Villa is the most relevant thing on that slide at the moment because we are now in the Premiership. Well, that's another story. But it tells you something about my role in what we do, the values I take into each and every project that I work on, and also the values shared by the teams I put together to do this work. So I am second generation Caribbean, I think. So I get lost if I'm first or second, because my mum went to school here, but I was born here, my mum came here really young, went to school here. I think she's first and I'm second. So we're from Jamaica. I was born and grew up in Birmingham, so you might hear my Brummie and my Jamaican accent coming through. I'm a proud Brummie. I have a background in the discipline of sociology and social policy, which means that my approach to doing research in this area has been slightly different, even though we've arrived at similar and some different places. I am a feminist, I'm a black feminist, and that informs some of my methodological approaches to the work that I do. And I have this interest in issues around social justice, inequality, the ethics of doing research. I am interested and have a fascination with people and their stories, and I am just really, really nosy. I think it's the curiosity that has helped me to manage the turbulent time we're having in our sector at the moment. So I just feel that when we engage in research, we take ourselves into that process, and knowing a bit about where we're from and our relationship to what we do sometimes can lead to some useful insights about our work. And this is the team of researchers that I've worked with to date. We've not all worked on every project, but combinations of us have worked on projects. We are really fortunate that we have researchers in the discipline of geography. When I put the team together for the first evaluation at H&P Rye Hill, I was asked to do it as a sociologist, but we're looking at an intervention that I think needed a geographer to help think about some of the frameworks and some of the methodologies, and just for us to share and bat ideas around together. I've just left a centre that was a psychology research centre, so some of my colleagues come from the discipline of psychology. I've worked with Dr. Martin Glynn. He's a criminologist at BCU University that does a lot of work around men in prison, particularly black men in prison, and he was a real support on our first project. And obviously Professor Maureen Eastby, who initially started working on looking at the role of the Master Gardener Programme, which is a gardening programme led by Garden Organic, as being a support throughout the process. So I think one of the most important things for us was trying to bring together people with varied expertise, knowledges, frameworks, methodologies. So what we could try and do is present a more holistic picture of the phenomenon or whatever it is we're sort of studying. Right. But what we are, we're researchers that start out with a real mission to try and make a difference. I'm not suggesting we always do it. I'm not suggesting that it's not without its challenging, but we start off with wanting to do something, wanting to make a difference, wanting to change something through our work. We want to do this collaboratively with the participants we include in our work. These could be individuals, families, communities. We want to work collaboratively with organisations delivering interventions and practitioners and policymakers. So we really advocate for a collaborative approach to research. And that means listening, adapting, compromising, being willing to lead and be led as needs be. And as I said, it's not the panacea, but and it's not always easy, but at the moment we are having some really interesting discussions and doing some really fascinating work. And these are just some insights into how we go about doing what we do. Our methods are eclectic, but largely we work within an interpretive framework, but not exclusively. We specialise in action, participatory action research, and we feel this is an approach that supports our wanting to work collaboratively, wanting to centre the voices of the people we include in our research. And we recognise how it provides an opportunity for us all to learn together. A lot of my knowledge around this area has actually been heavily influenced by the people that I've been working with for the past 5 years. So we're learning together throughout the process, and because we're interested in capturing the self-perception and views and experiences of key stakeholders, we feel that our methodologies are one of the important ways of acting as a conduit for their voices. So I'll give you an example of how we pick, choose and bring methods together. So this is what we did for the H&P Raphael evaluation. The idea was that we would spend a minimum of a day, a month in the prison, where we would do formal activities, maybe focus group interviews, collect participant observation, but we'd also do the informal thing where we would just talk to the men in prison, talk to staff, talk to the drug team delivering the intervention, talk to the team from Raphael, the team from Garden Organic who were leading the intervention. And what we want to do is sort of embed ourselves within the field in order to get the best understanding we can of how that intervention works and the impact, more importantly, of what they're doing on all the key stakeholders. And by key stakeholders, I don't just mean the men in prison. I'm talking about everyone we feel are really important to bring along in order for the interventions to be as effective as they can be. So yes, we did 152 hours participant observation in the summer, great. The winter, not so great. We did some focus groups with staff and with prisoners, but what was really fortunate for this study was that we were able to speak to family members about their perception of the impact of the intervention on their family member in prison. So we just try to do as much as we can a sort of a 360 and just use different types of data in order for us to understand what was actually going on. So what did we find? I don't know if that's big enough. Moya did say to make it slightly larger. But what we found of very much what we've heard today, we found that the interventions, whether they were delivered in, whether it's the Unlocking Nature programme or the food poverty programme or the intervention at Raphael, were really beneficial in terms of encouraging people to work together and encouraging people to building people's health and well-being. They're really good in terms of providing opportunity for people to learn or develop skills. They offer access to a therapeutic environment or to an activity that gives them some therapeutic input. They help to create learning spaces. And what we're starting to do is trying to map all this across 5 projects at the moment. So we're partway through that work, trying to bring the data from each of these individual studies together to see what that tells us. But we know it works. And we know it works because different actors and different people that we've worked with validated the impact on them. So I've just included a few quotes from different people that we've spoken to in the work that we've done that just told us how they felt. So the first one is from the Unlocking Nature project. And they said, I've always felt wherever there is a lot more greenery and garden spaces, flower pots, etc., it makes prisoners feel better. it normalises the prison environment. It makes it feel less of a prison. So I was really positive about the initiative and embraced it, and that came from a prison officer. The next one, it's a great emotional journey for me as someone who has a number of underlying mental health issues. It's had a great impact on me. This week so far has been no exception. With some new issues going on, it's helped me not to explode. And that young man, I can remember quite vividly, he had some quite severe mental health issues. We would arrive at the prison 9 o'clock in the morning, and he would be there really quiet, sat, not talking. We knew actually, because of the medication he's been given, that sometimes his interaction in the mornings were not particularly positive because he was still recovering from the medication he had taken the night before. But by the afternoon, he was always open and willing to talk. And the garden he described to me as saved his life. It was quite interesting because one of the things we find out with these projects is who you put in these spaces is really important. It's all right saying having a garden space, but sometimes, particularly in a prison, if you put people together and you haven't got the right sort of support, it can be counterproductive. So he was one of the prisoners that they didn't want to go in the garden. He was overruled by, I think it was the prison governor who overruled. They put him in the garden. He had no problems in the garden. His behaviour improved substantially. He didn't self-harm because he used to self-harm quite a lot. He never self-harmed in the garden. However, what he did do was self-harm sometimes on the wing, self-harm on the wing in his cell. And his behaviour was so up and down that they didn't think he was the right person to put in the garden. But after a period of time in the garden, self-harm reduced, mental health, as described by him, he felt a lot better. And then the one from the final quote there is from the Food Poverty Project, and it's about the self-confidence, self-esteem that people get from being able to learn a skill and share that with others. So opportunities for learning. These are just images of the initial stages of the garden at HMP Raphael. Everything in this image was built, it was designed and built by prisoners themselves. They were fully involved in the process. They also had an opportunity to decide what to grow, and they also had an opportunity to take what they had grown in terms of salads, vegetables, and all that back to their cells as well. And this is just a quote where someone talks about the importance of gardening in the community, bringing people together. I'm quite happy to share the slides. So what's it all about? Why did we do it? I think we've identified a number of positive outcomes. These outcomes we think we can map to the meso, micro, and macro level. So not only do these interventions have the potential of impacting positively on individuals and families and communities, these interventions have a positive impact on the organisations delivering the interventions, and also some of the interventions have been put forward as evidence of good practice, the research has, for social prescribing. I mean, the Raphael project was used as evidence in the parliamentary debate. So what we want to do with our work is see how we can bring evidence together to support the learning of organisations delivering the interventions. I think understanding the theoretical underpinnings, I'll leave that to you. But for me as a sociologist, my involvement in these projects was often about how can we support the improvement of interventions that support rehabilitation or support organisations in delivering projects either in the prison or in the community. So I think there is some evidence from our work showing that it operates over a number of different levels and it is effective. And these are just some of our key learning points about building confidence, all the things we've heard this morning. And I just want to say this is not without its challenges. It's not without its challenges from organisations who are trying to deliver these interventions, and it's not without its challenges for people like us researchers trying to research and better understand and generate evidence to help sustain, build and argue and fight for more of these sorts of interventions to be put into definitely prisons. I totally agree with the comment made this morning, but also as a means of supporting the increasing number of people in our communities living in poverty and deprivation, being isolated and so forth. So I'm really pleased to have been invited today. I'm quite happy if anyone wants a copy of our reports to email them out, and these are just a few references.
Thank you very much.